Hey, welcome back. Today we're going to be talking about the glute med, which is an important muscle right on the side of your hip, starting from this bony spot called your greater trochanter and fanning up towards the crest of your hip. We're going to start out with how to take care of trigger points in your hip. We've got a peanut here. You can use a lacrosse ball, you can use a tennis ball, or anything like that. All of us are going to start out laying on his side, putting that peanut right on the side of his hip. He's modulating the amount of force he's putting on there with his bent leg and through his arm, putting as much as he can comfortably tolerate. He's going to start out rolling up and down that glute med, finding tight spots, and he's going to sit on it for 20 to 30 seconds. He can internally rotate, externally rotate his leg to stretch out that muscle as it's pinned down by that peanut at the same time. After he's worked that spot out, he can move along different fibers of his glute med, or even more towards the back of his hip into his glute max and into his piriformis. Trigger points in this muscle are important to work out because oftentimes they can lead to pain radiating down the side of your thigh into your knee or even down into your lower leg. And it can feel a lot like sciatic pain. If you're having similar pain, it can be important to get it checked out to make sure that you're doing the right things to take care of it. If you're not having great success taking care of it yourself, one thing that we would do here is dry needling. It's a very precise and quick and effective way to take care of those trigger points. Next, we're going to move on to how to stretch the glute med. Next, we're going to talk about stretching out the glute med. Anytime I'm stretching a muscle, I think about what does that muscle do so I can stretch in the opposite direction. Your glute med brings your leg out to the side. So I'm going to start by having Oliver take the leg we're stretching on the outside, place behind the front one, and then take a step out this way with his front leg. He should already start to feel a little bit of a stretch through his hip here. He's going to push his hip towards me to enhance it, holding onto that squat rack for balance. If he needs a little bit more up the chain, he can bend his torso over and grab up high to feel through his obliques and through his lats. He's going to hold that for 30 seconds to a minute. And as he's coming out of it, I'm going to have him engage that glute muscle to bring him back up out of it. It's important anytime we stretch, because we're gaining new range of motion, to engage the muscle in that new range of motion so that we can control that space. Next, we're going to talk about exercises for the glute med. Next, we're going to talk about an important exercise for the glute med. As we talked about with stretching, it's important to think about what those muscles do. In open chain, that leg gets kicked off to the side. But in closed chain, it's important for stabilizing your hips. So think about when you're running, not letting your hip drop. We're going to be doing a fire hydrant today. So Oliver's going to take that band, put it around his legs right above his knees. Then, the first thing Oliver's going to do is hinge at the hips and push his butt back. He's going to stand on one leg, and then the leg that's up is sweeping out in a quarter circle away from that stance leg. The important thing is that this leg is just as active as that one, pulling out in the opposite direction against that band to stabilize at the hip and at the knee. He'll do about 10 reps here, switch to the other side, do 10 reps, and that's a great primer for any sport like running to make sure that your knees and your hips are stable. Thanks.